Does postpartum hypertension increase risk of future hypertension? Have you ever wondered how a woman's health after giving birth can impact her future? Specifically, let's talk about postpartum hypertension and its connection to future hypertension. Postpartum hypertension refers to high blood pressure that occurs after childbirth. It is important to understand how this condition can affect long-term health. Research shows that women who experience hypertensive disorders during pregnancy, such as preeclampsia or gestational hypertension, are at a higher risk of developing chronic hypertension later in life. In fact, women with these conditions have a 2 to 3 times greater chance of facing persistent high blood pressure after delivery compared to those who had normal blood pressure during pregnancy. For example, studies indicate that about 10% of women aged 20 to 29 who had hypertensive disorders during pregnancy developed chronic hypertension 8 years after giving birth. This prevalence is similar to women aged 40 to 49 who did not have hypertensive disorders during their pregnancies. The risk of developing future hypertension is particularly high within the first 5 years after giving birth. This time frame is critical for monitoring and early intervention. Blood pressure patterns in the first year after delivery can vary significantly. Approximately 70% of women who have high blood pressure 2 months postpartum continue to experience elevated blood pressure 1 year later. Several factors can influence postpartum hypertension. The severity of the hypertensive disorder during pregnancy plays a role, as does the medical treatment received after delivery. For instance, intravenous fluids or medications used for postpartum hemorrhage can affect blood pressure levels. Interestingly, even women who do not have a diagnosed hypertensive disorder but show certain blood pressure patterns early in pregnancy may still be at increased risk for future hypertension. This highlights the importance of comprehensive blood pressure monitoring during and after pregnancy. From a management perspective, it is essential to identify women with postpartum hypertension or hypertensive disorders during pregnancy early on. Regular blood pressure monitoring postpartum, including home measurements, can help detect persistent hypertension. Counseling and risk assessment can guide lifestyle changes and possible medication to prevent the progression to chronic hypertension and reduce cardiovascular risks. It is vital to remember that postpartum hypertension is not just an immediate concern. It serves as a marker for long-term cardiovascular health. Therefore, integrated care approaches are necessary for women who experience this condition. In summary, postpartum hypertension significantly increases the risk of developing chronic hypertension in the future. This makes postpartum follow-up and cardiovascular risk assessment essential for women affected by this condition.